Sophie, and this is Christie Clinic's Medical Minute. We're here with Dr. Kamen speaking about high blood pressure. So why is that a concern?
Blood pressure is a concern because the elevated pressure damages the lining of the blood vessels, which makes them more vulnerable to plaque deposition, which then ultimately can lead to strokes and heart attacks.
And what type of blood pressure is considered that high number?
So an elevated blood pressure is defined as a 120/80 or higher, but the medical definition of hypertension is 130/80 or higher.
And what are some of the symptoms of high blood pressure?
Well, high blood pressure, you really don't feel the high blood pressure unless it gets extremely high. You can get headaches, fatigue, visual changes, but that's usually when the blood pressure is very high. So that's why it's always important to make sure you're following up with your primary doctor to get your blood pressure checked, because you won't know if it's elevated unless you check it.
And how important is it to prevent it? What are some of the steps that you can do?
Well, preventing it is leading a heart healthy lifestyle. So eating healthy, fruits, vegetables, lowering your sodium intake, limiting red meats, processed meats, and eating white meat, chicken, turkey, and fish, and also exercising. 150 minutes of aerobic exercise a week will help prevent elevation in blood pressure.
And why is it so important to continue speaking about blood pressure quickly?
Well, blood pressure is one of the leading risk factors that go and causes risks for strokes and heart attacks. So preventing blood pressure will ultimately prevent heart attack and stroke.
Thank you so much, doctor. This has been Christie Clinic's Medical Minute.